Hi, welcome to another episode of Talking with Docs. I'm Dr. Paul Zalzal.
And I'm Dr. Brad Wiening. On today's episode, we're talking about shoulder separations, or otherwise known as AC separations.
Yeah, so this is a fairly common injury. Usually occurs with a fall directly on the shoulder or contact sports like hockey, lacrosse. So can you grab a model there and show us what is the AC joint?
So the AC joint is in the front part of your shoulder, where the A is the acromion, and that's a hooked bony part of your shoulder blade that comes around from the back to the front and then meets your clavicle or your collarbone. And as that comes across, that has a little joint called your AC joint. And the joint is wrapped in a capsule or a lining of the joint, and there are a couple different ligaments that help hold the clavicle down. So when you fall, direct injury to that area causes a varying degree of severity of injury to your shoulder and typically pain.
Yeah, so this is a joint, but unlike most other joints, it doesn't really move that much normally. It's quite a static joint. So how do we grade these injuries?
So they're graded on a scale of 1 to 6, which is not actually critical, but it mostly relates to the amount of displacement of the clavicle with respect to the acromion. So not only how much it's moved typically up, sometimes it can move back or inferiorly, but also the amount that it's in relation to the acromion. So grade 1 is the most basic type, where the clavicle is still at the same level, and then as it goes up, it moves further and further up.
Okay, so how do we diagnose these? Well, history, the patient tells us what happened, and usually it's a fall directly onto the shoulder or hit into the boards. Clinical examination will show tenderness right over the AC joint, and then x-rays. In a grade 1, where the clavicle hasn't moved much, you won't see much on an x-ray, but in the other grades where there is some displacement, you can see it. And we do special x-rays sometimes.
Yeah, and so sometimes you do a special x-ray with weight.
Yeah, hold
see if
weight,
that makes a difference.
It down.
And because you have 2 of them, it's a nice way to compare. And the other thing on clinical exams, sometimes actually you can see the clavicle actually tending the skin, and patients come in and say, "This looks messed up.
Yeah.
Well, is this a problem?" And you say, "Well, it's all relative."
Yeah. So how do we treat these?
So typically the treatment is non-operative. So a short period of immobilization, primarily for pain control, and then gradually as your pain subsides, we increase range of motion with physiotherapy and returning you back to your normal activities. Do you put specific restrictions on people, Paul, right afterwards?
Yeah, I would. For the first few weeks, I say this arm is for show only. Don't use it for any heavy lifting or for any activities. And then I wouldn't let them return to their contact sport until I've got good evidence of clinical healing.
Sure. I tell them the same thing. I tell them to try to avoid overhead activity, and typically they want to do that anyway because it hurts so much. And yeah, for sports, for me, the reason I tell them not to do that is because if you fall, A, you could cause more damage, but B, when you fall, you require strength in your shoulders to protect your face so that it doesn't go smashing into the ground, and if you can't do that, it's just not good.
No.
It's not good.
No.
Do they ever need surgery?
Yeah, sometimes these do need surgery. Some of the more severe ones, so the higher grade ones, where there's been some displacement of the clavicle into the muscles, they sometimes do need a surgery acutely. Or down the road, if you've had, say, a grade 3 injury that was treated non-operatively, but you still have persistent pain, and you can have an elective procedure down the road to help with the discomfort.
And typically that operation it performs a couple different functions. One part, you can remove the end of the clavicle to reduce the rubbing of that joint, or the other part of the operation is to reconstruct the ligament that's been disrupted to essentially pull the clavicle down, and that can be done in a variety of different ways, which we're not talking about today.
Right. So the most common one, like a grade 1 or grade 2, treated non-operatively. How long before I can go back to my sport?
I say 6 to 8 weeks. But certainly there is some variability. What do you tell them?
Yeah, same. Clinically they're healed, so they're not in pain anymore. There's no more swelling, no tenderness. Then usually about 6 to 8 weeks, we're back to your sport.
And then I tell them, for the odd chance that they have persistent pain or significant limited function, typically I tell them ride it out for a year. I also remind them that about half the guys in the NHL are actively playing with this type of injury, but if they do have trouble at a year, then they can see a shoulder specialist to discuss the potential surgical options for their problem.
Thanks. I think that sums it up pretty good.
Excellent. If you guys have any other further questions, please feel free to email us at info@talkingwithdocs.com.
And remember, you are in charge of your own health.
And if you enjoyed these videos, please like them on YouTube or subscribe to our channel. And see you next time.
Thank you.